Welcome to Thursday Thought Leaders with Harbinder Narula on BW Healthcare World. One of the things that is a reality today is that the healthcare providers and the decision makers are from a different generation from their customers. The patients today are also including Gen Z. Burson recently came out with its Gen Z healthcare report, and to discuss this, I have with me in this episode Hemali Mahajan of GCI Healthcare. Welcome, Hemali, to BW Healthcare World.
Thank you so much, Harbinder, for inviting me.
Hemali, recently Burson came out with the Gen Z healthcare report. Would you like to share with us some insights of the report, the overview of what this report is all about? What came out of this report?
Absolutely, Harbinder. It's a really interesting shift that we are seeing. And the report has thrown us some data points that are really interesting. What's most encouraging is that 78% of Indian Gen Z are actively embracing responsibility for their healthcare. That's a huge step forward. We are seeing a shift from reactive to proactive, from preventive to a more holistic approach of well-being. There has been an evolution of healthcare priorities since COVID-19 and the increasing focus on physical health and mental health. They understand that it's all connected. 78% Gen Z in India embrace healthcare. That's significantly higher than the global average of 67% only. With access to digital health tools, personalized wellness plans, and mental health resources, they are making informed decisions about their well-being.
Good to see that Gen Z is finally taking control of their expectations in healthcare. What do you think has been the shift in their expectations from the healthcare providers and from the healthcare industry?
The evolving priorities lead to certain specific requirements. And that's what the interesting data points that this report throws on us. Gen Zs demand a hybrid approach. They want the convenience and accessibility of digital tools, along with the personal connections and expertise that come from a healthcare professional. 53% are open to exploring holistic or alternative medical treatments, implying they demand a well-rounded approach to health and wellness, not just a quick fix. Their emphasis on self-care technology-driven health management and demand for transparency from healthcare providers reflects a shift towards a more engaged and empowered approach to personal health.
So Hemali, this is fantastic. But do you think this is always online generation will rely only on the digital platforms for accessing healthcare?
Interestingly, it's quite a contrast. Despite being digital natives, 66% of Gen Z in India prioritize in-person care and value the connections they establish with healthcare providers. They trust doctors, hospitals, and clinics, and their trust in family and friends is notably high. It's up to 66%, significantly high from the global total, which is just 55%. It is not about replacing the human element with technology, it's about finding the right blend.
So when we strike a balance between technology and the human interface, do you think there are challenges that the Gen Z is facing in terms of accessing healthcare? Because there are conversations around cost, there are conversations around access. What is your take on this? What does the report really talk about?
Well, the report does talk about these pain points. Affordability and access to quality care is definitely on top as a pain point. The issue of misinformation online and the sources of misleading information. They also face struggles seeking enough time and attention from the providers. Being able to get doctor's appointments when needed is another major issue. Interestingly, 52% of Indian Gen Z declined healthcare or a doctor visit due to the high cost as well.
Given the challenges that the hospital providers, healthcare providers are facing to provide a seamless experience to the Gen Z or the Indian youth, how can we improve the healthcare scenarios for this generation. What's the biggest opportunity that is emerging from this particular report?
The biggest opportunity is to create integrated and personalized experiences that meet their evolving needs. 67% of Indian Gen Z believe that a doctor has prescribed a different treatment or medication to make it more affordable, highlighting their concerted efforts to provide quality and affordable healthcare experiences. Emphasis on in-person care and their openness to digital health solutions present a unique opportunity for healthcare providers. Empower this generation to take greater control of their health and well-being by finding the sweet spot where technology enhances human connections, not replaces it.
My last question to you is that we're talking about this report that Burson has come out with. What have been the key takeaways that you would like to share with our audience?
What we have understood, there are several misconceptions and generalizations that exist around Gen Z's approach to health. The importance of sharing the ground reality and providing in-depth insights into what this generation really values and wants is captured in this report. I think one of the biggest thing that how we have generated this report is by the use of our proprietary AI tool, which is Decipher Health. And for more information, I would request you, Harbinder, if you could just drop in a link in the message below so that people can reach out to me for finding more information on Decipher Health.
Thank you, Hemali, for this interesting, insightful conversation. Thank you for sharing the key takeaways that have emerged out of this study that Burson has done. I'm sure this is going to be useful to every person who's listening to this conversation in the healthcare industry.
It was my pleasure, Harbinder, and thank you for hosting me.
It's a pleasure.